I'm excited to be able to introduce Brenda. So my name is Heidi, and I work with Brenda at Dalhousie University. And Brenda Beagan is a sociologist who's been teaching in occupational therapy and occupational science for 24 years. She gave a version of this presentation to our school at Dalhousie University a little while ago. And in consultation with the folks, a little bit of the coordinating group here, who also have heard Brenda talk on similar topics, we thought this session might be valuable for this group as we as a network strive to create space for these important discussions and dialogues. So we're really grateful to have Brenda here. So welcome, Brenda, and everybody else to this session.
Thanks, Heidi. So Heidi asked me to present on something that, as she said, that I'd presented recently at our school. So I'm going to see if I can share my screen. And when I do, I won't be able to see anybody really. So if there's any, sorry, I'm just trying to make it bigger. All right, I can see Ryan. Can you see the screen?
Yes, we can.
Okay, thank you. So professionalism and activism, something that I spoke with our school council about recently, and I've expanded just a little bit here because my speaking with it at our school council was not exactly invited. Karina Valavera, who's on this call, she and I were finding that our students, especially in the equity group that we're both part of that Karina chairs, students were really starting to talk about activism and have been increasingly over the years, but especially since 2020, after the most recent resurgence of the Black Lives Matter movement, and now most recently with the Palestine genocide. So there's a lot of concern with students about activism. And so we, as the equity committee, brought it up at the school level. So I have talked about this at that level, and Heidi asked if I would bring this to the group here today. So just to start, to acknowledge that I'm speaking to you, you're all in different places, but I'm speaking to you from Mi'kma'ki, the ancestral and unceded territory of the Mi'kmaq. And if you don't know where that is, it's in the east coast of what's now called Canada. And in this land, we are all bound by the treaties of peace and friendship, which were signed here in 1725 through 1760. At the very same time, the governor at the time, Edward Cornwallis, a British governor, also signed a proclamation giving a bounty for Mi'kmaq scalps at the same year that one of those treaties was signed. It kind of sets the stage for the way that we have met treaty obligations in Canada over the decades. So professionalism and activism, the reason that this is becoming kind of a place that we can have conversations, I think, in Canada, and this will differ in each of your locales. In Canada, we have a competency document now for the profession of occupational therapy that explicitly requires anti-oppressive practice. And that's the first time we've had that. Some of us tried to move the profession in that direction back in 2006, and it was totally unsuccessful. We were at that point talking language of diversity. So we've now got language of anti-oppression in the required professional competencies. And in my perspective, and I would say most folks would agree, anti-oppression practice requires activism. Those two things can't be separated. And yet in Canada in particular, activism has been defined as incompatible with professionalism. Those two things are seen as not fitting together. So it's a tricky situation that I think is going to be something that's on the forefront over the next decade. If these are the professional competencies, there's going to have to be a lot of discussion in Canada about how professionalism can be met. The competencies require us to be anti-oppressive and require activism, and yet activism is defined as unprofessional. So in some ways, meeting your competencies means being, quote, unprofessional. So I think it's important that we start in Canada, at least, having the conversations about how to understand activism, how to respond to it, how to teach it. That's going to look really different depending on where you are in the world. I know there's other countries where OTs have been at the forefront of activism, so that's a completely different situation than we have here in Canada. In Canada, we've focused more on advocacy. So the professional competencies have included advocacy for a long time. And trying to tease those apart isn't straightforward, but in general, there is a distinction. Advocacy is when you're kind of working on behalf of someone else or some other group. There's usually some kind of a dialogic process going on. There's persuasion to try and change policy or practices. you're lobbying, educating, giving voice to somebody or some group, and are usually working with or alongside an existing system. And it tends to be more reactive. So often, like, you might be advocating for an individual that needs funding for particular equipment, or you might be advocating for services being expanded, or the mandate of your program to include somebody who would otherwise be, they've had their 3 visits and now they're kicked out of your program. So advocacy in that sense tends to be motivated by something that is not available or that's being withdrawn in terms of services. Activism, in contrast, is working to bring about social or political change. So it's often disruptive, usually disruptive, and it's about disrupting the status quo, the kind of everyday business that we take for granted, disrupting that as a change-making strategy. The disruption is not incidental, it's part of the strategy. So you're trying to direct action and draw public attention. So that attention, the outrageousness sometimes of what people see as activism is deliberate. It's about drawing attention to an issue. So it usually means working outside of existing systems, because the systems are the problem usually. And it goes way beyond amelioration of some concern to transforming the situation or the system. Often comes from the grassroots and is proactive, trying to bring about system or structural change. So that's quite different than activism or than advocacy. At the same time, though, those two things often work together. You'll see, like, if you think about the civil rights movement in the United States, for example, activists got things going, but you have to have people who are advocates to step in then alongside or immediately after to say, well, what would policy look like? What would legislative change look like? So you often have folks working together, sometimes the same people, you just shift gears, but you get activism drawing attention to the problem and focusing on the demand for change, and then advocacy facilitating creating change. So once you get attention, then what do you do? Think of an example from years back when I was more of an activist. When I was in my late teens, I think, I was a student here at Dalhousie, and in the department where I was a student, there was a serial sexual harasser predator. He was one of the faculty members. He was a stats prof, and we all had to take stats in my program. And he had 2 doors to his office, and he would literally lock the door when female students came in the office, and he'd kind of corner you at his computer and then start rubbing on you. Like, he just did all the classic sexual harassment stuff. And when we started talking about it and found out that this is what was going on, I'm 2 years from retirement, so I can say these things now. We spray painted his office door with the word sexual harasser. And the same night that we did that, we put a note under every faculty member's door saying what we had been experiencing as a learning environment in that program. And understandably, chaos reigned the next day. It was highly effective as activism. And the very next step was the department created a sexual harassment committee, and I chaired it. And so I was ready then to step in. I knew enough about sexual harassment policy to then step in as an advocate and say, what would policy look like? For example, we created an open door policy for faculty offices. So things like that often work hand in hand, the activism followed by advocacy, or same time, but different strategies. So when activism and kind of oppositional politics are seen as unprofessional, we have to think about how we're going to do that. Anti-oppression, any of the work that we do now as anti-oppression, anti-oppressive practice, and any kind of activism, we're not always skillful at it the first times that we do it. It's just like every other skill. So if you look at in Canada, the professional competencies document, there's 7 domains and 42 competencies required. And all of them have to be learned. Students don't come in knowing how to do those things. And none of us come to activism knowing how to do it. So one of the challenges is when people do it, they're usually not very good at it at first. They do it clumsily. They do it maybe targeting the wrong people or using strategies that aren't effective. And I think it's really critically important, especially as students are starting to learn activism, to avoid a kind of knee-jerk response that says, shut it down. We have to help each other to learn principled activism if this is now a professional competency in Canada. And sometimes that's going to mean learning from our students, because frequently now students are coming in with way more experience than most of us have on resistance, on activism. And so it means being open to learning from students as much as we are trying to teach them. But I think there is also ways to help each other learn and to help students learn when they don't have the skills necessarily. They have the passion and the commitments, but they don't always have anti-oppression skills. So in the midst of what's happening, the genocide in Palestine right now, I happened upon this article by Tasha Wyatt and her colleagues in medical education. And I think it's really helpful. I think the way they've framed resistance as professionalism is incredibly useful. It's a way that has helped me think about shifting the way I teach this with students. So I'm going to talk a little bit about their article from 2024. And they talk about resistance as opposing social harms and injustices. And your goal is to stop them and prevent them from reoccurring or hold those who are responsible to account. And they did interviews with a whole series of medical trainees. So this is people from interns and clerks up through residents, all the way up to the highest level of residencies. And what they found was among medical trainees, when they engaged in acts of resistance, and this was like resisting heterosexism, racism, classism, ableism within their programs, these acts were not thoughtless or careless, which is what they're often dismissed as. And in fact, there were very careful calculations going on among the trainees that they interviewed. Two major things that people were calculating, and the first one was what kind of power is being used against them or against others before identifying the right form of resistance. So some kinds of hierarchies are held up through force, violence, punishment, and so on. And you're not going to change those through a carefully worded letter or changing language use. Those things are going to require a different kind of resistance. Other kinds of hierarchies, like the ones we see in professional education, are upheld through expectations of conformity, compliance, deference, obedience, and so on. If you hold a riot or revolution in response to that, that's an inappropriate response to through the process through which that hierarchy is upheld. It's upheld through obedience. Uprooting it probably requires disobedience. So there's different forms of resistance necessary for different kinds of power hierarchies. So the first step in the careful calculations for professional activism or resistance is what kind of power. The second one that they identify is how hard to push. And they identified, using a theory of social change, three major considerations that the trainees were engaging in. One was context, second was subjectivities, and the third was interactions. So context, there was always this kind of cost-benefit calculation. So if we were to do this thing or say this thing, what are the costs and what are the benefits? And then costs to whom and benefits to whom. So sometimes the costs are to yourself or the group that you're working with, and the benefits go to others like yourself. Sometimes they go to others more broadly. So maybe the benefits are going to be, say you're resisting racism within your healthcare facility. The benefits would be potentially to all racialized patients or clients coming into your facility in the future. Who are the costs to? Maybe it's to racialized patients or clients, but maybe it's just to you as medical trainees in this case, or as OT students. And so then maybe you're willing to bear those costs for the benefits to a much larger group. Or the costs to you as a group of students right now are something that are fairly serious, but the benefits will be to all future students. That might seem worthwhile to you. And part of the cost benefit calculation that doesn't get talked about in their article, and that I think we need to talk about more often, is the cost of silence or inaction. And it differs by who you are, and I'll come back to that. One of my favorite authors ever, Audre Lorde, a Black American lesbian feminist poet and essayist, wrote that you're never really a whole person if you remain silent, because there's always that one little piece inside you that wants to be spoken out. And if you keep ignoring it, it gets madder and madder and hotter and hotter. And if you don't speak it out, one day it will just up and punch you in the mouth from the inside. And I love that quote. And it's always really resonated for me, because there's often been these times when I've just not said the thing, and it just like festers, and I just like over and over in my head thinking, I could have said, I should have said, I will say. And when I work with students now, I try to talk to them about, think about that as rehearsal. It's not that you failed and you failed to speak, but it is often mental practice. And there's a lot of things that we do in our lives that we do mental practice for. So instead of like hating yourself because you didn't say the thing, I try to encourage students to think about, what did they not say? What might they have said? What might they try the next time? And I also tell them, you probably won't say anything next time, but maybe the third time you will. And maybe you'll do it really badly. And then the fourth time you will, and you'll say it slightly better. So speaking up takes time and takes practice, but there is that cost of not saying or doing when you wish you had. And it's important to calculate that into the cost benefit. And when I've raised this with colleagues that I work a lot with, two of them in particular, Tara Pride, who I think is on here today, and Stephanie Bizeth, very quickly pointed out it differs by who you are. So sometimes staying silent is about maintaining our own privilege. So I can stay silent and it doesn't actually feel uncomfortable, because if I just ignore this thing that's going on, turn my head, if it's about racism as a white person, I can just maintain white privilege and I don't actually feel more angry or hotter, or like I haven't spoken the thing that needed saying, because for me, it's actually quite convenient and beneficial to say nothing. So that differs very much by who you are. And there's also in the study that Wyatt and colleagues did, sometimes the visibility of who we are means our choice to stay silent or not act is different as well. I can choose when I want to speak up about racism, for example, as a white person. Somebody who's visibly racialized, it's always going to be apparent that they're invested in this discussion of racism or this issue around racism. And if you don't speak up, that's also very visible to other people. It's like assumed that you will or should, and you may be like taking a responsibility for that that's much more intense than those of us who identify as white or are identified as white. So that's, again, a very different experience around silence. So the second calculation, context, is one of them. Subjectivities is the other. So who am I, or who are we in power relations? So identifying those power relations and positioning ourselves within those, and figuring out if we can afford the possible consequences. And I think sometimes we make the possible consequences bigger or more abstract than they are. And when we really nail down what are they really, like what are the actual consequences, they aren't as big as they might feel. So sometimes they are, but sometimes we kind of blow them up into a specter, or and it can immobilize us in ways that aren't helpful. But always identifying who we are in power relations. So the cost benefit calculation, for me to speak up as an OT student, for example, if I'm experiencing something in field placement, for me to speak up if I'm a student who's an A+ student who's acing this field placement, looks very different than if I'm a student who's at risk of failing. Those are completely different positionalities in that power relationship. Can we maybe mobilize official positions to resist? So often working with your union, if you're an employee, working with your student society, and anonymous resistance. Again, something that's seen as, quote, unprofessional, but often is the most safe and most effective form of resistance. Create a group. When I was an activist in my early 20s, it was a standard comment within activist circles that I was part of. Give it a name, call it a group, and you can do stuff. And no one knows whether your group is 300 people or 3 people, but you can make a point and speak behind a group label the same way the, quote, Senate of your university does, or the Board of Governors, or any of the groups, the employee groups that you're part of. You can have a version of anonymous resistance, and that may be seen as not following proper channels and therefore not professional. But when students in particular, or employees, or anyone in your circles are using anonymous resistance, it's usually because they perceive there's lack of safety. So the question should be, why are they perceiving lack of safety? Not why did they choose to go the, quote, wrong channels and go anonymous in their resistance. And then the other calculation that folks engage with and should is, who are the potential supports? For students, sometimes getting the support of allied faculty can increase their safety. Who can you bring in on board that would enhance the effect? So if you're doing a cost-benefit calculation, if you can enhance the effect of your action or your words, then that may tip the cost-benefit scale in a particular direction. So context, subjectivities, and then interactions. People engaging in professional resistance or activism do a huge amount of thought into what to say, who to say it to, and how to say it best, or what to do, when, where. A lot of thinking about, is this the right target? Is this the right strategy? Also identifying who appears open to growth and who may not be worth the effort. And that not worth the effort sounds perhaps more dismissive than I intend it to be, but sometimes you get pretty clear signals from folks that they're not going to change on this thing, and putting a lot of your time into them may not be worth the cost benefit calculation, where others may have given little signals that they're open to hearing. So if you find a lot of students or a lot of employees are approaching you with complaints about something, consider that a good thing. They're seeing you as open to change, open to growth. And then one of the calculations that the trainees in Wyatt and colleagues study engaged in was unintended impacts on relationships, which I thought was quite interesting. They might talk about the cost benefit calculation was quite positive for doing whatever it was in their circle, but when they considered about how they might affect relationships with other departments in the hospital, for example, their patients and clients might not get what they needed in terms of services and resources after that. So that was part of their calculation. Or they might do something or say something and cause ill will with their colleagues, and they were okay with that until they reasoned that the resistance they were engaging in would actually have limited benefit. So it might be worth creating ill will with your colleagues if it's going to have a big impact, but maybe not if the impact is going to be limited. So you make those trade-offs all the time. And one of my other colleagues that I work a lot with, Caitlin Sibbald, noted that these are exactly the kinds of questions that are about critical reflexivity and ethical decision-making. So it's not that this kind of resistance and activism is unprofessional. It's in fact highly professional. This kind of debating, what are the consequences, is ethical decision-making. So Wyatt and colleagues talk about skilled resistance as embodying ethical professional practice. And this is particularly true in Canada now when we say anti-oppression is a required professional competency in occupational therapy. So my argument is that we can teach and learn skillful activism and resistance. We're not born knowing it, but we can learn how to do it. And in the instances of activism, when we see them happening in our circles, we can ask about what were the prior calculations here, rather than shutting it down as rash or unprofessional. Maybe it was done poorly and it didn't have the effect that the group wanted. Then we can think it through with them, talk about who did you approach? Why did you choose them? Why did you choose that strategy and not another strategy? Why did you choose to say those things and not other things? And lead them through the kinds of questions that are helpful to ask. We can do it ourselves too when we're doing any kind of response to something that is unacceptable and oppressive, and think through with each other, how are we making these choices? In Canada, and this would be very different, especially in parts of the global south, the response is that it's too political, that resistance activism is inherently too political. And I think it's so hard to hang on to. If you're from any dominant social group, it's hard to hang on to the fact that there's no neutral. We are always being political, whether we're accepting the status quo or challenging it. They're both equally political. One feels political, the other doesn't. But as we build skills in anti-oppressive practice, in activism, in resistance, challenging the status quo feels a little less terrifying. When we first start doing it, our hearts are pounding and we're shaky and we're sure we're going to get fired or kicked out of a program or whatever. It can get less and less terrifying, and we can get better at it. So helping students to explore questions like the ones I've already talked about, talking about how unions or student unions support activists. If they do, are there other groups already doing similar work? Students have been raising significant questions about if they get arrested at a protest, civil disobedience, for example, will that affect their ability to get professional license? Heidi put a question out to the provincial college here to find out about that and got a very unclear response. I've asked them the same thing back in 2020 when students were attending the Black Lives Matter protests in Halifax. Again, very unclear. So getting clarity on that would be something that OTs can do if that's the case in their locale. Finding that out would be helpful to pass that along to students. Finding out what employers don't prevent you from activism. And even what happens if you do. When I presented on this work in my school, one of the colleagues said, well, my employer, she works for a very large employer, my employer would not allow us to engage in activism. And I thought, what would they do? No, seriously, what would they do? Would you actually get fired? And if so, do you have a human rights case there? Because I'm not sure you can fire somebody because they attended a protest. In Nova Scotia, in Canada, if you're paid by the government, you're supposed to not protest. So teachers, healthcare workers are not supposed to protest. And I remember Jaime is on this call talking to Jaime Lecce about this when he visited us in Halifax, and he was shocked. But what actually happens if you do? Do you get fired, or do you just get a slap on the wrist? I think we need to know that. And if it is problematic in terms of licensure, OTs should be working with our regulators to change that. It's part of our competencies. And when Heidi approached the college here, the response that she forwarded to me was that it's duty to the profession. That's not the same as it being prohibited by law. So we could say if our competencies require anti-oppressive practice, then it is our duty to the profession to be at every protest. And then the last two pieces I wanted to share, this came up on one of the, anyway, a group that I'm connected with now, working against the genocide in Palestine, that different activist roles fit for different people. And there's lots of different folks addressing this. This one comes from Deepa Iyer on Instagram, which I don't do. So I only collect things that people send to me other ways and I hang on to them. So I'm going to be teaching this to students this summer. Some of us are troublemakers and some of us are poets. Some are visionaries and some fetch things for others, bring coffee to the march. Some are orators and some analyze things. So there are different ways of engaging in activism, and they're not all going to be the same for all of us. So this is one version by Deepa Iyer, and this is another one that someone sent me from the Slow Factory. And they talk about the abolitionist, the advocate, the artist, the communicator, designer, visionary, troublemaker, problem solver, luminary, healer, analyst, architect, developer, engineer, inventor, writer, strategist, scientist, researcher, and negotiator. There should be a role for just about anyone here. So this is something that I find quite useful, and not judging ourselves or each other if we take up different roles than being on the front line with a bullhorn and a sign and camping out in the quad in front of your university administration building to protest the genocide in Palestine. We have different ways of engaging in activism, and they're all valid, and they often work extremely well together. So acknowledging those differences and that they're all valuable, I think, is an important part, and it's something that I will be adding into my teaching this year. So that's it for me, and I will stop sharing.